Today, we are covering the absolute foundation of safe medication administration, pharmacology principles. The NCLEX will not ask you to simply define pharmacokinetics. Instead, it will give you a scenario. A 78-year-old client with stage 4 chronic kidney disease is prescribed a standard dose of an antibiotic that is primarily excreted by the kidneys. The question will ask for the nurse's priority action. Your mind must immediately jump to excretion, the final stage of pharmacokinetics. Because this patient's kidneys are failing, they cannot clear the drug effectively, leading to a high risk of toxicity. The priority action is not just to give the medication, but to question the dose with the prescribing provider. This is a classic safety and advocacy question. Let's break down the 4 stages, but always link them to a potential exam question. Think of the mnemonic ADME. A for absorption, D for distribution, M for metabolism, and E for excretion. For absorption, the exam might test you on route-specific issues. For instance, an oral medication given to a patient with severe vomiting and diarrhea may not be absorbed, so the nurse should anticipate a provider's order for an IV formulation. For distribution, think about protein binding. If a patient has a low albumin level, they will have more free, unbound drug in their system, increasing the risk of toxicity. The NCLEX loves to test this with highly protein-bound drugs like warfarin. Metabolism is the big one, and it almost always points to the liver. A patient with cirrhosis or hepatitis will have impaired drug metabolism. The NCLEX will present a scenario where a standard dose of a drug metabolized by the liver, like many benzodiazepines, could become toxic. You must recognize that the M in ADME is compromised and requires intervention. Then there's pharmacodynamics, which is what the drug does to the body. The most critical concept here for the exam is the therapeutic index. The test will not ask for a definition. It will state that a client on lithium has a serum level of 1.8 milliequivalents per liter. You are expected to know that the therapeutic range is narrow, typically 0.6 to 1.2, and that 1.8 is a toxic level. The correct action is to hold the next dose and notify the provider immediately. For drugs like lithium, digoxin, and phenytoin, you must know the signs of toxicity because that is how the concept is tested. A common point of confusion for students is the difference between a side effect and an adverse effect. The NCLEX tests your ability to prioritize. A side effect is a known, predictable, and often manageable effect, like constipation from an opioid. An adverse effect is an unintended, undesirable, and potentially dangerous reaction, like respiratory depression from that same opioid. If an exam question offers you options for a patient experiencing both constipation and a respiratory rate of 8, you must address the respiratory depression first. It is always about the most life-threatening outcome. Remember this simple phrase when you see a pharmacology question. Organ function dictates drug action. If the question mentions a failing liver or kidney, it is a giant red flag that the standard drug action will be altered. And your job as the nurse is to protect the patient from the resulting risk of toxicity. That is the core of pharmacology on the NCLEX.